How quickly should blood pressure be lowered during hypertensive crisis? Have you ever wondered how quickly blood pressure should be lowered during a hypertensive crisis? This is a critical question, especially since a hypertensive crisis can lead to serious complications. When blood pressure spikes severely, it can cause damage to vital organs. Therefore, managing this situation requires careful attention. In a hypertensive crisis, the goal is to lower blood pressure in a controlled manner. The first step is to reduce blood pressure by about 20% to 25% within the first hour. This initial reduction is crucial to prevent further complications. However, in specific cases like acute aortic dissection, a faster reduction may be necessary. After this first hour, blood pressure should be gradually lowered to around 160/100 millimeters of mercury over the next 2 to 6 hours. This staged approach is important because lowering blood pressure too quickly can lead to inadequate blood flow to essential organs like the brain, heart, and kidneys. This can result in ischemia, which is a condition where blood flow is restricted. For patients experiencing acute myocardial infarction or unstable angina, the targets are even more conservative. In these cases, the initial blood pressure should be less than 140/90 millimeters of mercury. Care must also be taken not to lower diastolic blood pressure below 60 millimeters of mercury to maintain proper blood flow to the heart. To achieve these blood pressure targets, intravenous medications are commonly used. Some of the typical medications include intravenous nitroglycerin, clevidipine, and sodium nitroprusside. However, beta blockers may not be suitable in certain situations, such as acute pulmonary edema. The choice of medication will depend on the specific clinical scenario and any existing health conditions. On the other hand, if a patient has severe hypertension but does not show signs of acute organ damage, this is sometimes referred to as hypertensive urgency. In this case, blood pressure should be lowered more gradually over days to weeks. This slower approach helps avoid complications like myocardial infarction or stroke. In summary, during a hypertensive crisis, blood pressure should be lowered by about 20% to 25% within the first hour. Then, it should be gradually reduced to safer levels over the next hours to days. This careful management is essential, especially for individuals with heart disease, as it helps prevent further damage to vital organs.